Welcome to the press briefing. On stage, we have Dr. Albert Au, Principal Medical and Health Officer, Communicable Disease Branch of Center for Health Protection, as well as Dr. Sarah Ho, Chief Manager from Hospital Authority. Dr. Au will report the cases to us. Good afternoon, fellow citizens. I'd like to report to you, i.e. the 7th of March, the latest information from CHB on COVID. Yesterday, 28,475 cases were confirmed through PCR tests. Case number 496,774 to 525248. Among the 28,000 odd cases, 3,472 were confirmed by the HA, 2,051 cases through public health laboratories. The remaining 22,925 cases confirmed through PCR tests of private laboratories. Among these cases, 9 were imported. Remaining 28,466 cases were confirmed through PCR tests and local. The CHP public laboratory conducted genome analysis on 2,551 cases, and no LR25 positive cases were found, and 1,643 cases were negative to L452R, meaning they are Omicron cases. The remaining 48 cases results are pending, or the viral load was too low. Yesterday, we announced that the online declaration system for individuals tested positive for COVID-19 using RAT was launched. It was launched at 6 p.m. yesterday on the 7th of March. From 6 p.m. yesterday to 23:59 hours, we received a total of 1,736 reports. Please refer to this chart. Among these, 17,236 cases. Now, this is the total number we received since the launch of the system at 6 p.m. yesterday. So the members of the public have reported their RAT positive results through the system. Among the 17,236 cases, once they are in our system, matching will be done. Some of the cases were found to be on our system for confirmed cases, and we used their ID numbers to confirm that they were confirmed cases through PCR cases, and some of them were repetitive reports, perhaps some locked in twice. So there are 14,715 valid reports if we deduct those already known cases to us. These are new reported cases, no repetition, and they were never in our system of confirmed cases. Among these 14,715 cases, we sent SMS to them, asking them to submit ID documents and their RAT result pictures as at 00 hours. Among the 14,715 cases, 2,018 cases completed all the requirements of uploading information, and then they were verified. We have issued isolation orders to these 2,000 odd cases, and their household contacts was given SMEs requiring information to be provided. The remaining 12,697 cases, the information is still pending from them. After they have uploaded their pictures of RAT positive results and ID document, will we issue isolation orders as well as quarantine orders for their household contacts. Once we've completed this procedure, we counted as confirmed cases for tomorrow. I'd like to talk about outbreaks at care homes. Yesterday, there were another 23 care homes with cases of outbreak. Among them, 15 are elderly care homes and 10 or 8 homes for the disabled, involving 278 cases, 234 involving residents and 44 involving staff members. As of now, 690 care homes have got outbreak, accounting for 86.9% of all the elderly care homes in Hong Kong. About 69% of the homes affected have got over 10 cases each. A total of 16,200 residents and about 4,470 staff members were involved. Now, for homes for persons with disabilities, so far 230 of these homes have got either cases or outbreak, accounting for 68.7% of these kind of homes in Hong Kong. Among homes with outbreaks, about 66% of them have got 10 or more cases, involving about 4,800 residents and 1,710 staff members. As regards the number of deaths in care homes, we have recorded at least 1,224 deaths. 1,222 were in elderly care homes and 2 in homes for persons with disabilities, involving 431 care homes. Total number of fatality. As at yesterday, in the 5th wave in Hong Kong, we have recorded 2,365 fatal cases, up 291 from yesterday's tally. So far, the death rate is 0.46%. Age range from 11 months to 108 years old, and there are 5 involving children younger than 10 years old. 114 involve adults aged between 18 to 59 years old, accounting for 4.82% of the total number of deaths. 2,241 cases affected people who were 60 or above, accounting for 94.8% of the total number of deaths. Most of these cases, or 1,638, affected elderly persons 80 or above, and they account for 69.3% of the total number of deaths. For the new fatal cases yesterday, 4 were certified dead upon arrival of the ambulance. They did not go through HA's system. 3 males and 1 female. The samples were taken by our forensic staff, Department of Health, and they were confirmed and aged between 32 and 85, and the date of death was 16th of February, the 1st of March, and 2 on the 3rd of March, respectively. Now, as regards the state of vaccination, so far, 19.5% of the death cases have not been fully vaccinated. About 76% of them were never vaccinated. As for death rate, overall speaking, those who have not been fully vaccinated has a death rate of 1.52% compared with those who have got 2 jabs of vaccination. Now, for this group, the death rate is 0.06%, a difference of 20 times. Now, for elderly persons not vaccinated or fully vaccinated, the death rate is as high as 10.32%. Compared with those who have received 2 jabs and over 80 years old. Now, for this group, the death rate is 2.2%, and the former is 5 times higher than the latter.
Dr. Ho, 1,359 confirmed patients who are in public hospitals and North Lantau Hospital Infection Control Center, HA Infectious Disease Center, and AWCTF for treatment. Last night, we submitted 74 patients who were in critical condition, 105 in serious condition, 69 in ICU for treatment. As at midnight, over the past 24 hours, 160 COVID-positive patients passed away, 92 male and 68 female, ranging in age from 4 to 105. Of those who passed away, 86 came from care homes, 116 didn't have any record of vaccination, 25 had one vaccine dosage, and 19 had two, and there are 145 aged over 65, and a number of them were younger. There was a 4-year-old girl whom I reported yesterday, another 20-year-old male. He suffered from a heart condition and renal problem, so he's a chronically ill patient. He was unvaccinated. The third one, a 25-year-old male. This patient was a resident from a home. He suffered from a brain condition and cerebral palsy, and he suffered from impaired intellectual problem and chronically ill. And a 36-year-old male patient, he was a care home resident. He suffered from a Down syndrome and also cerebral palsy. This patient, these patients passed away over the past 24 hours who were in the younger category. There is a time lag in terms of statistics. We are reporting the figures from 21st of February to 6th of March. 127 patients passed away, which have not been announced. 68 males, 59 females, ranging in age between 56 and 102. Over the past 24 hours, 778 patients recovered and been discharged. 69 patients were picked up during admission screening, and 74 co-patients or fellow patients were listed as close contacts. 10,400 staff members have been infected, and 2,394 have returned to their posts. I now throw the floor open for questions. Please raise your hands and wait for the mic. For putting questions, please identify the organization you represent. Yes, the one in front, please. I'm from Phoenix TV. We noticed that at the RET reporting platform in the first few hours, we had 200,000 people waiting to make a report. Dr. Al said 17,000 or so cases that were recorded. Is it in line with your expectation? With the new figures, can you assess the current situation regarding infection? How do you assess the COVID situation now? Now with PCR tests and the rapid test platform, can we say that we have hit the peak? We rolled out the platform at 6 p.m. last night. We said yesterday that those who tested positive using RAT today and yesterday we're supposed to make a report. We'd like to collect the latest positive cases to start with. So they are regarded as new cases. As we said yesterday, after the launch of this platform, we're going to be allowing a week's time to let those who test positive between 26th of February and 5th of March, and we allow these patients to submit the information to us. Yesterday, on the platform, we received a lot of reports from the members of the public. The lady mentioned 200,000. I think she meant 200,000 people logged on the website. When you log on, there is a queuing system, and that there would be information to show that you are queuing. If there are a lot of people queuing, you will be told that you will have to wait a bit of time, and you will be put on the waiting list. And the waiting list was as many as 200,000. For those who successfully logged on to make a report, we collected all the information. I announced 17,236. I am referring to those who tested positive on March 6th and 7th. And these are the valid reports, and we would regard them as new cases, and we would assign a case number to them. We also received other cases that test positive between February 26th and March 5th. These figures, we will have to wait until March the 14th, when the whole process is completed, before we can announce the final figures. The one in glasses, please. TVB. For these RAT positive reporting platform, that the quarantine order is for 14 days. Under the policy, on day 6 and 7, if there are 2 negatives, the quarantine would come to an end. Do you have to update the guidelines on quarantine, or do people have to follow these guidelines as stated? Hong Kong U has the latest research that show that on the 4th of March, we have already hit the peak. Thus, the CHP subscribed to this proposition. And this is for the HA. It is said that Queen Elizabeth Hospital is going to be turned into a designated COVID hospital. How soon are we going to see this in operation? And how are you going to deal with the patients that are already in the hospital and other hospitals that are also in the pipeline?
Thank you very much for your question. Now, for cases reported to the system, now if the test was done on the 6th and the 7th of March, we will issue an isolation order. Now, the day of sampling is considered day 0, and then the person will have to be subject to 14 days of isolation, as announced previously. If a patient tests positive when he no longer has symptoms, and on the 6th and the 7th days, if the RAT result is negative, then his life can resume normal. And the prerequisite is he has had 2 doses of vaccines. Now, if he is unvaccinated or has only received 1 jab, then the patient will have to be isolated for 14 days. If it's never been arranged to a CIF, then on the 14th day, a negative RAT result can allow him to resume his normal life. Now, there is no way we can tell whether for a patient he will be tested negative on the 6th or 7th day. So the duration of an isolation order is always 14 days, but we have made it clear in the order that under the latest arrangement, a patient tested negative by RAT on the 6th and the 7th days will mean that the isolation order is over. And if he is not tested negative, he can continue to administer an RAT test until he has 2 negative results on 2 consecutive days. For the current situation, we do not see an geometrical increase in the number of cases. We have about 50,000 new cases per day that was steady for a few days, and then the figures dropped to 30,000 odd, and in the past couple of days it's been 20,000 or so. We have to keep in view. It seems that we haven't seen a multiple increase of cases. It was not like in early February when the number of confirmed cases just multiplied. Perhaps it's because of the cooperation of the public and also the government's social distancing measures. The situation has now eased. But we have to observe the situation very carefully. Starting from last week, members of the public have been using RAT quite commonly. So with the system launched yesterday, we hope to include RAT positive cases into our system so that we have a better idea how many cases are there in the community on a daily basis, and to take follow-up actions. That is to decide whether the patients should be isolated at home or at CIF. Let's wait for a few days, and then we can tell how many confirmed cases we have, including both RCT positive and PCR positive cases. We'll have to wait a few days before we can see a clearer trend. We have over 9,000 patients being treated at different clusters of the HA. As mentioned by Dr. Lee yesterday, our focus now is to reduce death, reduce serious cases, and reduce infections. So more and more hospital facilities will be converted to receive COVID patients. We have converted Tin Shui Wai Hospital and North Lantau Hospital and Cornwall Hospital as designated hospitals. Gradually, wards or the whole floor or the whole hospital will be converted to boost our capacity to receive COVID patients. We're now considering infection control measures, including corridors for patients and our operation, and how to provide training for our staff. Now, in transfer of patients and provision of services, we are still exploring, and when we have further information, we will let you know. The lady over there. I'm from Orange News. We've got 17,000 odd reported cases. How many of them indicated that they're willing to go to a CIF on the system? And after making a report, how long do they have to wait before they can be moved to ICIF? Now, there are 24 beds in CUHK Medical Center. I'd like to know the occupancy rate. How many patients have been referred from public hospitals to CU Medical Center? Who will have priority to use the beds? And as for the date of turning QEH into a designated COVID hospital, and how many COVID patients do you expect it can receive? Let me repeat what I said. Now, the figures I gave you just now was the total from 6 p.m. to 00 hours yesterday. So we received 17,236 reports. After cross-checking, we removed some already known cases and also repeated reports. So in total, there was 14,715 persons who reported to us. After that, they'll have to submit pictures of their RAT positive result and also their ID document before they can be considered a confirmed case. We have to verify their identity. And once a case is confirmed, an isolation order will be issued and will arrange for the case to go to a CIF. I don't have no information as to among the 2018 cases already verified have been screened and considered suitable to move to a CIF as a matter of priority. But we do ask them a few questions. The reported persons will have to tell us whether the home environment warrants any priority in moving to a CIF. For instance, if the household is rather crowded, and whether he is a high risk or whether his family contact is a high-risk person. And then after receiving information, we will make a decision. Except for cases that we don't consider appropriate for a CIF. For instance, he needs looking after, he needs to look after somebody else, or he is main care of the family. Otherwise, anyone aged between 18 and 65 with no or mild symptoms are suitable to be moved to a CIF, and the list will be sent to the Security Bureau, which will make matching as soon as possible. When there are suitable places in CIF, these reported persons should be moved to a CIF as soon as possible to prevent further infection in society. Dr. So. The CUHK Medical Center has admitted 4 COVID patients aged between 64 and 83. They are in stable condition and require short-term rehabilitation. Many hospitals are making the necessary preparatory work, and if we have further information, we'll let you know. This gentleman over there. Hello. Dot News. The government is trying to vaccinate residents of elderly care homes in full steam. I'd like to know the number of homes that have been covered in the vaccination program. I know the government is cooperating with other medical organizations. There will be outreaching doctors to care homes to vaccinate the elderly. Do you have enough manpower? What difficulties have you encountered? And as for care homes for the elderly and persons with disability, there are quite a number of cases. How many of them have been sent to CIF such as Asia World Expo, and how many are being treated in hospitals?
At the moment, the vaccination program for the residents of care homes is the top priority in the government. The Department of Health, the Social Welfare Department, and the Hospital Authority are joining hands to scale up the vaccination for the residents of the elderly care homes. We have implemented a number of measures over the past months. We have streamlined the consent form arrangement. If the family members do not raise an objection to the residents being inoculated, then after medical assessment, they will be arranged for vaccination. And we have streamlined all the consent procedures. Also, we're arranging more medical staff to administer the vaccination. Together with the DH and the HA, we have set up some dedicated teams to expedite the vaccination program. We are liaising with the doctors and the healthcare organizations to have more manpower for this purpose. We have the elderly or the district health centers, which are open for the elderly citizens to turn up for the vaccination without any appointment. And we are trying to raise the proportion of the senior folks being vaccinated. Dr. Ho, I can supplement the information later on. The last one row, the lady in green, please. In media. A question for the HA, what is the latest utilization rate of the ICUs in Hong Kong? In the public hospitals, how many ICU beds have been increased since the start of the 5th wave? There are some public hospital doctors who are telling us that the negative pressure wards have accommodated ICU beds, and how much more room can this be done? And the doctor said if we cannot increase the number of ICU beds, then the utilization rate will hit capacity. Would there be any further measures? Also, there are many patients who died of COVID. Will this have any impact on the organ transplant work? About the utilization of the ICUs, it is 80% or thereabout. We do have the mechanism whereby the ICUs of different hospitals will be covering one another. When necessary, we will transfer the patients across. The HA is monitoring the situation on a daily basis. In terms of organ transplants, we are still carrying on with the invitation. However, it all depends on the wishes of the family members. I think we have to have the cooperation there. An English question, please. A lady over there, please.
Thank you, doctors. I'm from Bloomberg News. Can we clarify the numbers that we're getting from the newly launched reporting platform? The 14,000 effective cases that was announced, does that mean that these cases are new cases that were tested positive yesterday, so we should view it together with the PCR confirmed cases, which is 28,000, just to get a better picture of how the infection numbers are trending in Hong Kong. And with the coming days, if the cases from February and March are also logged, how are you going to basically record this on the CHP database in tracking the outbreak? And my second question is about suggestions from the mainland medical expert Liang Wannian. He is saying that we should prioritize reducing serious cases as well as deaths. And there's been suggestions of a reverse quarantine of elderly people, maybe moving the senior residents who are still healthy out from residential care homes and maybe into a separate isolation facility to protect them. Are those considerations being discussed right now? And my last question is about the compulsory universal testing campaign. There's been a lot of talk of priority shifting away from running the campaign as well as postponing it. Has there been any updates on when that campaign is going to happen? Thank you.
Thank you for your questions. For the question on the RAT platform, as of yesterday, since we launched the platforms from 6 p.m. yesterday until midnight, we have recorded about 17,236 persons who had use this platform to submit their information to us. And after they submit their information, we have checked against our own databases and found that some of them are already confirmed cases, or they have a repeated registration or submission of information. So after the deduplication, we recorded about 14,715 new submissions, and these people has provided information that they have tested positive through the rapid antigen test on either the 6th or 7th of March. So we have sent SMS message to them to request them to go to another link to submit their Hong Kong identity card documents, and as well as the image or photo of their rapid antigen test. And so far, up to midnight yesterday, among these about 14,000 persons who have submitted information, 2018 had completed the submission of further documents. So we have verified these 2018 cases as confirmed cases and issued the isolation order to them, as well as quarantine orders for their household contacts. And they will be treated as confirmed cases. So apart from the 28,475 PCR positive cases recorded yesterday, we have an additional of 2018 RAT positive confirmed cases recorded yesterday. And this figure will be updated in our dashboard later tonight. So this is the situation. For the remaining cases who have not yet submitted their identity document to us, we have already sent them SMS, and we expected that they will or they have already submitted their identity documents as well as the photo to us after midnight. So the new cases will appear in tomorrow's figures. That is the figures for today from midnight to 2359 to this evening. So these figures will be announced tomorrow. For the second question on community universal testing, as mentioned before by various government officials, the exact details as well as the planning and operations is still under planning by various government departments. This will be a very major operation involving various government departments and a lot of people. So the details are still under preparation and discussion among the experts. So I have no further to supplement at this moment.
Next lady here, please.
Good afternoon from the South China Morning Post. My first question is for Dr. Ho. So can we confirm if Queen Elizabeth Hospital will become a designated hospital for COVID patients? If yes, when will that be, and where will non-COVID patients be transferred to, and how many non-COVID patients will that involve? And my last two questions are for Dr. Au. So is the declaration on the rapid antigen test platform a legal requirement, or is it simply highly encouraged or essentially voluntary? The queue was very long last night, but we didn't see as many submissions as the number of people in the queue. So is lack of enforcement a reason why we're seeing such low numbers? And how long do we need to observe until we see a peak in the daily caseload? And I'd also like to ask about what people can do if they tested positive on RAT before February 26th, since their submissions to the platform will not be valid. How can they get document proof of infection? Thank you.
For the question on the RAT platform, after submission of information to us, we encourage the citizens who have tested positive by RAT to provide the information as well as submit the relevant documents to us, because we need to verify their identity, and also we need to check the information, because there will be legal implications. If they are after the submission of the documents, we will treat them as and confirm the case. So their status will be a confirmed cases of COVID under our system. So we will issue isolation order to them under the CAP 599A regulations, and as well as issuing quarantine order for their household contacts. So it is necessary for them to provide their identity card and also their rapid antigen test image for us so that we can verify their information. And we will treat them as confirmed cases.
And the most important point for us to do is to decrease the mortality and also decrease the severity of the cases and also the infections rate. So, and all along, hospital authority have been converting different units, including the ward and even the whole block and whole hospital, to receive COVID positive patients. Previously, we have converted the North Lantau Hospital and also Tinshouvel Hospital. So in coming forward, we will also continue to convert other units to increase our capacity to increase to take intake these patients. So we are still undergoing the preparatory work. So we'll announce once ready.
We encourage people to report their positive rapid antigen test through this platform because there are several advantages. First of all, this will help the government to check the epidemic situations because if they are tested positive, then we want to know the actual or the number of people who are tested positive every day, so that we can closely monitor the epidemic situations for our policy making as well as the decisions on prevention and control strategies. Secondly, this is also very important for the persons to have a record of their positive test in our systems because they are tested positive, so they are confirmed the cases. This will have implications on their future medical records, including the vaccination, etc. So it is very important for people to report to us so that we can classify them and also issue some documents to them to certify that they are confirmed cases. And thirdly, because they are confirmed cases, so it is under the CAP 599A regulations, they need to have isolations at home, and also their household contacts also needs to be isolated. So we need to issue quarantine order and also isolation orders for the cases and their families. So it is necessary for them to report to us, otherwise we cannot issue such orders for them. And lastly, also, because they are confirmed cases, they will need to be isolated or arranged to be isolated in community isolation facilities. So if they do not report to us, then we cannot make such arrangement, and this will cause risk to the community as a whole, as well as to their family.
下一位，嗰邊第咩議？
Next, the gentleman in white on the other side. I'm from HK01. The leader of the expert group, Mr. Liang Huanen, said that we must grasp the opportunity for a comprehensive, universal, compulsory testing. When is the right moment to do that? Now, in private clinics, if you want to receive a jab, you have to submit your student ID card and also a student handbook. But for children under 3 years old, they may not have such documents. What should they do? And it is said that in Chengyi CIF, people confirmed at different stages might be put under the same room. Would there be risks involved? And if patient is in such a situation, what can he do? Now, for RAT positive cases, now if a person doesn't report to the platform, will he be legally liable? Regarding CUT, different departments of the government are making preparations and ironing out the details. I have nothing to add in particular. The CHP has always encouraged people to be tested as early as possible. There is no need for you to wait for the CUT, no matter when it starts. So if you feel that you have symptoms or you are at risk, you should either administer an RAT or a PCR test. For both tests, positive results are considered confirmed cases. So if you are confirmed, you can take measures. You can stay home, so can your household contacts, waiting for a further test to prevent the spread of the virus. This is in line with the infection control strategy of the Hong Kong SAR. We always want early identification, early detection, early isolation, and early treatment. Now, if we have CUT, then within a very short period of time, we can identify all the silent cases in society, and then we can take measures to cut the transmission links. As regards details of implementation, the government will make a decision soon and announce to the public. As regards RAT, we encourage members of the public who are RAT positive to report. Now, we require them to report to us through the platform. First, here's a confirmed case. He should be isolated at home, and so should his family members. Once information is reported to us and with his ID submitted to us, we can then issue an isolation order for him and quarantine order for his family contacts. And if need be, we can liaise with the Security Bureau and arrange for these patients to go to a CIF to prevent further spread of the disease. Now, if there are high-risk persons at home, for instance, those with immunocompromised situation, and if they catch the disease, then there can be a very high risk of complications. So anyone who is RAT positive should make good use of our platform. Please report your result to us, and your information, or you'll be considered a confirmed case and will be kept in our database of confirmed patients. And so your status will be a confirmed case, and under the law, we can issue isolation orders and quarantine orders to the patient and his family contacts, respectively. And by reporting positive results to us, CHP can monitor in real time the state of the epidemic in the community. Previously, we could only rely on PCR results to ascertain the number of new confirmed cases, but we rely on our laboratories. With the widespread use of RAT, now for members of the public who cannot have an PCR test, do use an RAT, which is a reliable test. And if you are infected, I hope you can report your results to us so that we know the number of new cases on a daily basis, so we have a more accurate grasp of the trend of the epidemic.
At the present moment, this is on a voluntary basis. This rapid antigen test is a voluntary exercise. We do encourage the members of the public to utilize this platform to report to us. We would spot check and administer PCR tests to confirm the positive cases. The gentleman at the back. Now TV. A question for Dr. Au regarding the reporting platform. The figures you announced refer to the positive cases over the past 2 days. I'm sure you must have got to grips with the positive cases that tested positive earlier, you must have the information with you. Why don't you announce the details without having to wait until March the 14th? Because it doesn't make sense to wait this long. I think you should let the public know about the latest situation before, with the information they can ascertain whether the trajectory is going down. For those who tested negative using RAT, they would have the order discharge, but then they may test positive again using PCR, and they would have to be subject to quarantine again. You should explain to them that they don't have to be subject to the quarantine again because they've already tested negative, or is it the case that to play safe, all these cases will be subject to another round of quarantine to make sure that everything is okay? Well, when we launched this platform yesterday, we were encouraging the members of the public to report the positive results. The whole design of the platform is for the members of the public to report to us the positive result as soon as possible. So we asked the public to make a report on positive cases today and yesterday. And let's say I test positive today, then I make a declaration on the platform either today or tomorrow. We hope that the public would inform the CHP as soon as possible so that we can issue the isolation order and arrange for them to go into an isolation facility, because if we delay this any further, there is a likelihood of further transmission. So we'd like to pick up the new cases and implement measures to snap the chain of transmission. We regard the RAT positive as confirmed cases. This was announced on the 26th of February. Now, between February 26th and March 5th, some have tested positive and they may have already recovered. We still allow them to make the declaration so that we can supplement the isolation order and the quarantine order. We allow them a week's time to do so. For those who tested positive within this period, not all of them have made a declaration. This may be happening in stages. We allow them to supplement the positive result until March the 25th, and we will be consolidating the information to ascertain how many of them are positive cases using RAT, and we will be announcing the numbers. Right now, people who test positive using RAT, they can make the declaration either today or tomorrow. So from 6 p.m. to midnight yesterday, we got hold of the positive cases from earlier days. That doesn't reflect the situation because we don't know how many people have tested positive between February 26th and March 5th. So we'll have to wait until we have completed the day-back process before we make the announcement about the final numbers. You refer to the positive, the RAT negative, after RAT negative, and then testing PCR positive. What's going to happen? I don't have the information on the case you mentioned. Normally, if someone has tested PCR positive, then we would regard that as a positive case, and we would assign a confirmed case number. We would issue isolation order and the quarantine order to the household contact, and he would undergo rapid test on day 6 and 7. If there are 2 negative results, then it would be regarded as negative. And if he tests positive, again using PCR, then there may be a re-positive case, and the CT value may be pretty high. Now, for these re-positive cases, we do not regard them as new cases, that there will not be any more isolation order to be issued. As we said in our system, all the positive cases are the PCR positive cases. We didn't have any information on people who tested positive using RAT. If someone tested positive using RAT, we didn't have the information at the time. And when we received the PCR report, we would possibly regard this as a new case, and the isolation order would be issued. At that time, the RAT results were not recognized as confirmed cases. Now, with this platform, if they make the declaration, and once we have made the confirmation, we would include all the details into the database. If there are any further positive reports, that they will not be regarded as new cases. The lady at the far end, please. Ming Pao Daily. Now, for today's confirmed cases, is it 28,000 plus 2,000 or 28,000 plus 14,000? How do you work out the numbers? You mentioned 12,000 cases have not completed all the procedures to submit the ID information. Do you have any deadline for people to upload the information after SMS has been issued? For those who have already made the full declaration, how many of them have already been sent to hospital or CIFs? Dr. Au, you mentioned 5 children who passed away. Previously, you mentioned 4, and there were a 4-year-old and an 8-year-old. I mean, the number doesn't seem to add up. Can you clarify on this, please? This question is for the HA. For the Tier 1, Tier 2 designated hospital and AWE hospital, how many beds are available there? Dr. Ho mentioned some hospitals will be converted into COVID hospital. How many more beds will become available in this exercise? Also, for the 5th wave, we can see that there is a child under 3 who is in ICU. Do you have any details exactly how old is he or she, and what is the health condition? The ICU utilization is about 80%. It seems that there are 60 or so people in ICU, and we were told that the utilization rate was 90%. Have there been any ICU beds added, and where are they added? How did it work? Thank you. Thank you for your question. The first question is about the confirmation, the confirmed figures. Now, for PCR tests, we confirmed 28,475. We have 2,018 that are detected from the rapid antigen test. The number seems to be on the low side because we only launched the system at 6 yesterday, so the numbers represent the numbers from 6 p.m. through to midnight for the 6-hour duration. So it may seem a little bit low. Now, for these 14,715 cases, they submitted the information after midnight. We have already sent them the SMS. Some of them, on my way here, I found that most of them have already uploaded the ID information after midnight. We have already verified the information, and the isolation order has already been issued, and they are regarded as new confirmed cases. For these cases verified after midnight, they will be announced tomorrow. So we will be working on a day-by-day basis. We have two sets of numbers, the PCR positive cases as well as the positive cases arising from the RAT. So from midnight to 23:59 today, the number will be announced tomorrow.
CIF for RAT positive cases, they'll be treated just like PCR positive cases. Once they are known to us, information will be submitted to the Security Bureau for arrangement to go to a CIF. The Security Bureau will consider a number of factors and place them in suitable CIF. Death figures involving children. From CHP with case number, there were 5. We announced previously, including a 11-month-old baby, 1 3-year-old, 2 4 years old, and 1 9 years old, and one also reported by a doctor yesterday, an 8-year-old girl. Once verified, we will assign a case number and include it in our total death tally. Speakers off mic. We hope that once a person receives our SMS, now once he has reported to our system, then within a very short while he'll receive an SMS. He has to log on to the platform for ID verification. He has to input his phone number, his ID number, as well as after a successful reporting, he'll be given a reference number. This is to ensure that his information will not be leaked if he has lost his phone. And after uploading to the platform, he will have to give us his ID and also his RAT positive image. This must be done because we need such information to verify and confirm his case, and after that we can issue isolation order. So after initial registration, there will be a registration number, and as soon as he has received our SMS, I hope he can upload the necessary documents to us. As for CIF, who should be placed to what CIF, I don't have such figures with me. Let me talk about the child younger than 3 years old. He attended the A&E department of United Christian Hospitals on the 2nd of March. He has been feeling unwell for a few days with fever and runny nose, and then he has asthma because of constriction of the respiratory tract, and he attended the A&E department of UCH. We considered him critical, so intubation was done at A&E to protect his respiratory tract, and then he was transferred to the ICU of QMH for treatment. After treatment, his condition improved. We used bronchodilator and also steroid to treat him. Antiviral drugs were also given, and his condition is now better, and he doesn't need intubation anymore, and his situation is improving. We're now boosting our capacity to admit COVID patients. We're gradually increasing the number of beds. We can have 100 or so more. And as for the occupancy rate of ICU, we have been adjusting the situation and keep in view when necessary. We can deploy resources to take care of patients in need. This side, I'm AM 730. It was mentioned that hopefully after receiving an SMS, a patient should upload information as soon as possible. when will that SMS lapse, and have you got information on invalid reports or false report of repetitive reports? Now, TMHK Medical Center said that they would accept patients aged 16 to 75 years old, but then you just mentioned that it has admitted 4 patients aged 64 to 83. So do they admit patients based on their age or their condition? And the platform require the reporting person to state whether he needs admission to NCIF. Now, if he has stated no, or his home environment is suitable for isolation, will he still be assigned to a NCIF, or can he stay home for isolation? The website has got a phone number for registration. Do you have any figures of RAT positive cases through the phone number, and how many of them have already submitted their RAT positive image? Now, for the SMS, I hope members of the public can give us the necessary information as soon as they've received the SMS, because we need such information and ID verification for follow-up work, including easing of an isolation order and arrangement to stay in a CIF. We want to have the latest situation of positive cases. We don't want the case to stall for a few days. So once RAT positive, a case should be reported to us the latest the next day. And as soon as you receive an SMS, you should report to us at once. We do not have any time limit for uploading the ID, but I hope it can be done within 24 hours, because we must have the ID before we can confirm a case. We don't want members of the public to respond too late, because that would make the whole system pointless. Because if a case is only reported to us if it was tested positive a few days ago, that would mean more high risk to the community. And if he can't be admitted to a CIF in a timely manner, he may be spreading the disease at home or in the community. We appeal to the public for their cooperation. We believe generally members are willing to be cooperative and report to us their positive results as soon as possible. Yesterday, there were some late submissions of ID, probably because when the system was launched, we were very careful. We don't want to overload the system. So we controlled the sending of SMS, but now the system is mature. We hope to send out an SMS as soon as a case is reported and information can be uploaded to us at once. Now, that 2,521 cases, these were not false reports. Now, while I don't have exact figures, it's just that some of them, on checking their ID, were found to be previously confirmed cases through PCR tests, so we will not regard it as a new case. And we will not issue a new isolation order or quarantine orders as appropriate. We'll just give them an SMS. These persons do not need to register because they were already confirmed previously. And there were cases that registered twice. After inputting data, one may thought that his case was not successful, so he tried again, and we will disregard the second input. So after removing the duplicated cases, we have 14,715 valid reports. I don't rule out that there were some false reports and some malicious reports, but then we can't say for sure how many of them were false reports. We need their ID cards before we can verify and consider them confirmed cases. When it comes to CIF, our strategy is early detection and early isolation. If we have sufficient CIFs, we hope that each and every case that can take care of himself can go to a CIF. For stay home safe it is for household contacts, but not for the case itself. When we have sufficient CIF, we hope that all cases can be arranged to go to a CIF as soon as detected. Because they are already confirmed cases, they should not stay in the community anymore to remove the risk of a further infection.
Given the shortage of CIFs, we would be doing the screening. We would arrange for the high-risk people, in particular those who are living in cramped condition or those with high-risk family members to be prioritized. We do have the hotline. There may be some who are not well up in the computer system. The hotline is 1-836-119, 1-836-119. There is telephone recording service. If people don't know how to use the digital system, they can call through this hotline and they can leave their ID numbers as well as their contact numbers on this hotline, and we'll be contacting them back to get hold of all the relevant information and arrange for the isolation facilities. As to TMHK Medical Center, our consensus is that for those who are in stable condition but still need some rehabilitation treatment, they will be taken on. There is no across the board in terms of age. They are prepared to take on any patients. Let's make it the last question, please. Cable TV. On the 27th of February, some patients tested positive on RAT, and then on PCR, he was tested PCR positive subsequently. Would the sick leave be counted on the RAT positive day or the PCR positive day? What about the mortuary? Is it really full to capacity? What are the reasons why you fail to handle the bodies? And the undertaking business said that it would take a couple of days for the death certificate to be issued. And we know that there are some Omicron medication sold in some pharmacies, and there are no particular brands attached to them. Now, for RX pharmacies, there are pharmacies there, but there are some pharmacies that don't have there are dispensaries that don't have pharmacies there. Does the government enforce the law? Now, you said that for RAT positive cases, they will be counted in tomorrow's figures. Do you include those 2018 cases that already completed all the procedures? For the first question, on February 27th, someone tested positive using RAT. The government has already announced that RAT positive can be regarded as positive cases. And then he tested PCR positive again. Now today is March the 8th. On the 1st of March, he tested positive using PCR. The case has already been sent to us. For the March 1st positive result, he has been already regarded as a positive case, and there is no need to make any further declaration using the platform, because the first positive result was on the 27th of February, and for the PCR positive result, this has been regarded as a positive case, and there is no need for any further declaration. As to our figures, you are right that they have to submit all the relevant information before the case will be regarded as a positive case. There are procedures that have to be complied with. We do need to have the ID number, because otherwise, under the law, there is no legal effect. And you mentioned the bodies. The DH is aware that over the past week or so, the number of people who passed away in the A&E has increased sharply. We have implemented a whole lot of measures to increase the capacity. We have borrowed some storage facilities from the private sector, and starting from March the 2nd at Fushan Public Mortuary, we have put the refrigerated storage facilities on the car park there, and all these have been completed on March the 7th, and we can handle 1,100 bodies with these storage facilities. We will be increasing the temporary storage facilities where necessary. We're grateful to all the different entities like the ASD, Water Supplies Department, EMSD, TD, the police, the FEHD, and all the rest of the departments, and also CLP and the storage facilities suppliers. We're grateful to them for making provision for the temporary facilities outside the Fushan mortuary. We understand that the number of bodies has been increasing sharply, and we need to make submission to the coroner's court, and we have to spend some time to go through all the procedures. The DH will be deploying manpower to handle the situation. We'll be communicating with the relevant parties to see how best we can expedite the procedures in order to shorten the time of the body storage. Speaker not coming through. Now, if it is PCR positive, we would have issued the quarantine order starting from the 1st of March. That's all we have time for today. Thank you all very much.